CBS News Hour.
Connecting Organizations for Regional Disease Surveillance CODIS has ended a two-day workshop of the Ebola Intensified Preparedness Program on capacity building training of trainers in affected and not yet affected countries at the Riviera Hotel in Guinea. The training targeted decision makers, supervisors and coordinators. Well, Hawa Barry was part of the team from Sierra Leone and she now reports.
Messages like this was absent during the initial outbreak of the Ebola disease in Liberia, Guinea and Sierra Leone. All three countries were not prepared for such outbreak and the response was relatively slow and communication about the disease was also weak. Based on this, that is why CODIS is holding a series of capacity building workshops for countries affected and not yet affected by the Ebola virus. Participants were drawn from Sierra Leone, Guinea, Liberia, Senegal and Togo. The Intensified Preparedness Program focuses on communication and community work to help build the capacity for preparedness and response, establish trust between communities and healthcare workers to enhance resilience in communities. During the experience sharing sessions, it came out clear that no country was prepared and responded very late when the news broke out that Ebola had entered neighboring countries. This led to many deaths in the countries worst affected by the disease. Patrick Conroe says in Liberia, authorities were scared to go to Lofa County where the disease first broke out as the information they were receiving were mixed information from the ground. This was the same situation in most countries. Professor Nigel Lightfoot, Executive Director of CODIS, says it is key that countries involve people in the communities for information dissemination.
Working in communities, within communities, getting into communities in their languages and giving them the information that would help them make decisions and the right decisions was the way to actually improve the response. There were other things that came out, but this was the major one.
At the final day of the workshop, the Minister of Health in Conakry, Guinea, Colonel Remy Lamar, says it is important to involve the community and treat Ebola culturally, politically and socially. He says taking the fight at community level is paramount and key in the fight against Ebola. Aissata Mandor is a senior lecturer in public health and nursing education at the Jala University College. She explains how far Sierra Leone is with the fight against Ebola.
The response has improved and of course, before now, there was community participation, but it wasn't that very strong. But for now, we are reaching out to communities, we are engaging communities, we are giving this work ownership, we are giving ownership to the community for them to know that this is our fight, this is their fight. We all need to come on board so that we eradicate Ebola once and for all from Sierra Leone.